I'm Elaine Sims. I'm on the campus of St. Catherine's College. We are now over in Hamilton Hall. We have moved locations because we are over here in the Allied Health Building to talk to Carol Sherbach about who is the director of the radiation therapy program here at St. Catherine's. And we're here to talk about an exciting new machine they have. I only want to go over a little bit about their credentials just for our viewing audience because they're going to say, I've seen her before. What is it exactly she does? She came to us when she was at University of Kentucky, then you went to Texas, and then you came to St. Catherine's, and you've been head of the radiation therapy program here now for a year and a half.
Yes.
I hate to run through this so quick, but we have so much information to cover. Then new on board is Tom Rowley, who came to us also from the University of Kentucky.
Yes.
And there your position was
Clinical supervisor.
clinical supervisor,
Yes.
and here you're the clinical
Coordinator of the program.
of the radiation therapy program
Yes.
department. We have a new machine here at St. Catherine's, which I understand is the only one.
One of 7 in the country.
Okay. We want to explain this so for our viewing audience can try to understand this. It is called a virtual environment radiation therapy training unit.
Yes. And the exciting thing about it is it allows our students to practice real types of patient situations, but in a completely safe environment of the classroom.
Clear of radiation. And
Right. Well, and clear of having the added distraction of being in a real working environment.
Okay.
So they can, in a more relaxed environment, get their skills on learning how to use the equipment. And the best thing is this is exactly like a flight simulator that a pilot would use. So the pilot would practice on the flight simulator before they actually go into the real airplane. And this is one of the great things we have now. There's very few of them, and this allows us to have the students excellently prepared before they go into a clinical environment to work with patients.
And it's three-dimensional.
It is.
Which is pretty exciting, and we're going to have some examples of that
Yes.
on the screen. But it's almost like we're not walking into the human body, but you can see it. It's not flat
Right.
screen.
No.
X-ray therapy and radiation. X-ray therapy has just gotten. I mean, X-ray has
In general,
become
yes.
so advanced.
Right, and the great thing is that we can show concepts now that we've never been able to demonstrate before with students. We can show the beam as it comes out of the linear accelerator. We can show it as it enters the patient. We can show the dose that's being delivered by the machine. We can give them a really good appreciation for what actually is happening now. We've never been able to look inside the body in a training situation to see what's going on, and now we can do that with the student. It's a huge advantage to education of radiation therapists.
Radiation therapy, when I was in hospital work 50 years ago, I mean, they would put pins around it, and and even, I know someone that had pancreatic cancer that was radiated, and it burned them up. I mean, now I assume this really pinpoints. You're going straight to the point. You're going right in there.
The equipment we have today, linear accelerators, they only deliver the dose to the tumor. So we don't have any of those, very little of those reactions happening with the equipment we have today. And our equipment today is very conformal, meaning it's going to just treat the tumor volume. So we can avoid critical structures like your lung or your heart or your spine, and we can just paint that dose around the tumor. And the physics behind it, again, is going to make the dose go inside the body and not outside. For example, somebody with my complexion, you go outside and you're going to get sunburned. But the dose here is inside the body in the tumor.
Okay. Even as a nurse, I'm going to ask this question. When you're going to actually give this treatment to a patient, a radiation treatment, does this machine automatically focus on that one thing, or do your technicians control that from the outside?
The radiation therapist is the individual who works closely with the physician, the radiation oncologist, and before the patient gets treated, we do what we call a simulation. So we take them into a CT simulator where we can get a 3D representation of the body, and through that we can plan treatments. But one of the most important things in that process is we can identify marks on the external surface of the body that correlate to the tumor inside the body.
Okay.
So the radiation therapist on the treatment machine can then place the patient on the table, look at these external marks, and then go and treat the patient accurately.
Okay. So you're not going to have as much danger, say, if you had thyroid cancer of burning up the esophagus. I mean, and then that's probably a little far-fetched, but I mean, it's going to be much more precise.
Right. The conformal treatments we have today the equipment can actually move around the patient and deliver the radiation only at certain intervals to not treat, for example, the esophagus.
Well, now that we've talked about that, how did St. Catherine's get this piece of equipment? I mean, it's pretty amazing. There's only 7 in the country, and one of them's sitting right here now.
Right. Norton Healthcare in Louisville graciously donated money for the radiation therapy program, and part of that grant was the ability to purchase this equipment we have today.
Really?
So it is we're very thankful for Norton for their generosity in allowing us to purchase this equipment here at St. Catherine's. I'm
not going to ask you on television how much it costs, but I will when it's over. This is pretty exciting. I mean, I can tell you're exciting because, I mean, you walked into the room and it's like, it's a buzz. And it's so new that you're really not even sure how to exactly, well, how long has it been here?
It actually arrived on July 29th. It took the engineer 3 days to install it. Then a physicist, Andy Beavis, from Virtual, he's actually one of the people who created this piece of equipment. He actually came from England to train Tom and I on it. So we spent 2 days of training, August 8th and 9th.
No wonder you came here.
Exactly.
And then the students started the next Monday. We got trained on Thursday and Friday.
So this machine's made in England?
Yes.
Okay.
Yes, all of this equipment was shipped in through customs from England. And the interesting part is one of the boxes accidentally got sent back, and you know, modern technology, they FedExed it. FedExed it from England, and it was it was actually in Elizabethtown within 24 hours.
My goodness, my goodness.
It's amazing.
I'm sure you're excited about teaching this to your students.
Yes.
Have you started?
Yes, we've started incorporating it into our lectures and things like that. It's really great to be able to show them a concept on the board, explain something to them, and you don't have to just say, someday you'll see this. I say, okay, let's go over. I'm going to show you this right now. Yeah. You know, it's not somewhere down the road, you know, you might run into this, you know. You're going to look at it right now. So you can take it and apply it right away.
Well, this is the Cadillac, but the Mercedes of this, like you said, was the machine where you can almost walk into the human body.
Right,
and project it from the back, and you can take an actual tour of the human body.
Right, they actually
That's so cool.
They actually have one equipment that is completely immersive 3D. Which is, I think there's only one of those in the country.
Now, what level does your students need to be? When do they start using this? I mean, as far as in the process of
in the
getting their degree.
Of the program.
Junior year of the program.
Yes.
So how many students do you have using this right now?
4.
4.
Mm-hmm.
Wow.
Yes.
And
they use it right here in this room?
Mm-hmm.
Yes.
Okay.
Yes.
And we lecture in this room and use the VERT, and we started with our class. Well, we couldn't resist. We just got the piece of equipment but the first day of class.
Yeah.
We had it up and running, and we're showing even the class that just started. It was their first day of class. We even used it with them, and they can catch on very quickly.
Do they realize what they have? These kids realize what they have here?
I think as they're going, especially the ones that are going to the clinic and actually working with patients and then coming back and seeing the concepts here, I think it really is like, wow, this is really showing me something that I don't get to see, you know, at the clinic ever.
Well, and then when you think about pancreatic cancer, how wonderful this would be if
Yes.
you got to radiate, which is, or, just because it's just so hard to.
Yeah,
to
and they understand the
pinpoint.
concepts of trying to, why you're angling the machine and why you're doing certain things to avoid hitting this structure or that structure and,
And anatomy.
It just makes so much
yeah.
more of it make sense of
Yeah.
what you're doing.
Yeah, I mean, I think they're going to come out with a greater understanding of just the inside of the human body.
Yes.
It's amazing. It's
Absolutely.
amazing. Gosh, it's so exciting, and I feel like when I walked in here and saw what you were doing, I just thought, how are we going to wrap our brains around this thing and what it is? And there's going to be images on the screen to show, which will be, they'll show what they are. But medicine, since 1965, has just, the
Yes.
first cardiac cath ever done in Louisville was done when I was a student nurse.
Okay.
I mean, it was exciting,
Well, the advances in our field have happened so
Oh.
quickly that, we don't even have the same treatment regimes now that we had even 10 years ago.
Yeah, yeah.
Our field is rapidly changing, and that's another reason to have this piece of equipment, because we can stay abreast of all the latest and the greatest that's going on in the field and demonstrate it to our students.
Yeah. Well, I think a lot of people are afraid of radiation, but I think when they see that it is being perfected every month, that there's constant. It's just like technology. It's just
Exactly.
amazing. Thank you both so much for being here. And I know this was a rush. I felt like we had a lot of information to cover. I think if anybody's really interested in this, they need to maybe make an appointment. You sound like a really busy lady, but still, it would be interesting for them to see that. I feel like people might want to see what this is and
Yes.
think about it, because I hear so many people talking about going into radiation therapy or mammography, but they really just don't know.
Yeah.
This, just to me as an old nurse, is very exciting.
It is.
Very,
It's-
very exciting.
We're going to try showing that this is an actual treatment machine. So Tom is going to actually move the gantry, and then we'll go in and zoom in on the
Okay,
anatomy.
okay,
Okay.
okay.
Go ahead.
I'm ready.
Okay. Okay, this is a image of a actual treatment machine that you might find in any cancer center that you went into in the country. It's a virtual treatment machine. We can move it and manipulate it the same way the therapist at a cancer center can do. Move the head of the machine around, adjust the table up and down, and all different directions to get you lined up. So now we're going to kind of simulate more of a treatment. So turn room lights off.
What's that
Cool.
big blob in the middle? Is that a body?
That is a torso of a person.
It's a representation of what you might see in the clinic. So it's this is a simulated treatment, so we kind of have the outline of the body here. And if we zoom in a little bit.
That's
you
just
can-
the trunk of the body, so you're looking at the chest, and
This
then
is
up there is
just
the
the
face.
chest.
Okay,
This is just the chest here, so here's the shoulder area.
Right.
And then here's a lung, and then here's another lung here. The yellow down here is the spinal cord, and this dark blue here would represent the esophagus. So our students could come in here and see this, and they could line the patient up, the simulated patient up, and then they could, with these lasers, and then they could look at the anatomy. We can see how the treatment beams are actually entering the patient and how the treatment's being delivered.
and the purple thing is the tumor.
Yes.
Which is quite large.
This big giant purple here, that is the tumor. And this is the right lung, and this is the left lung.
Okay. Cool.
Okay, I'm kind of unsure.
So what you're doing is the lines, you're outlining the tumor, and then when the radiation goes in, it's only going to hit the tumor itself.
Yes.
It's going to bypass everything else. So it's much more precise and much more pinpoint.
Right. The only area we're going to treat is going to be the tumor volume here.
Okay.
So we're going
Okay.
to avoid treating the lungs, the esophagus, and the spinal cord.
So you would tilt the patient different ways to avoid the lungs and stuff, so forth.
No, the patient does not move.
Okay.
The patient remains stationary, and what happens is that the machine will actually move around the patient,
Okay.
and the beams will come on and off, And Tom can demonstrate how
Okay.
the actual beams would actually come in and treat the patient.
And if it moves around the machine, it would be like an MRI where you've got these, when anybody that's had one, but it's just going into their body where it's exactly supposed to go in and not touch any of the other organs.
Right, and you can see here where the blue here is the beam coming in
Oh, okay.
that's going to treat the patient. So that's the beam, and we can go through and actually run the beam. So now the radiation is being delivered, and you can tell how it's changing and moving to different areas. And what this represents is that we're avoiding critical structures. And this particular treatment has 6 different beams that we would use to treat the patient. And this way we can go through and demonstrate with the student about how this particular treatment would work. And so now Tom has made the external surface of our simulated patient transparent, so we can go in and look at how the beam is treating the patient. So this is extremely useful when we are going through.
Well, and I don't think you can probably predict this, but maybe you can. A treatment like this would usually take how long?
Something like this, the actual time that the beam is on is only going to be, just a couple of minutes, 5 minutes. It really doesn't take very long.
Okay.
Now, getting the patient in the room and setting the patient up may take a little bit longer.
The preparation time.
Right.
Sure.
Right. So the patient can, depending on the treatment, be in the room anywhere from 10 to 30 minutes on an average treatment. But the actual time that the beam is on is really quite short. And one thing that's extremely useful with this equipment is the fact that we can go through and look at the CT, the cross section you can see right here of the individual. You could see a cross section here of anatomy, and then we can relate this directly to any tumor volumes that we have, and we can move that through the body, for example.
Goodness gracious. It's wonderful. Okay. Thank you very, very, very much.